Well, you can't have avoided all of this stuff going on about the VA hospitals and all the terrible tragedies that have gone on here. Who knows for how long? I saw the first stuff about this back in 1999, and so we're talking about 15 years. At least I've been on the front pages of the newspapers. So this is not a simple problem, but somebody needs to go to jail. Many people need to be fired, and people begin to start taking care of themselves, and that includes the veterans. So again, I'm giving out the invitation for veterans from the Gulf War forward to today. I will personally pay for them for their $10 to become a Youngevity associate, so they can actually begin to earn some income, and also to learn how to take care of themselves. Most of the problems that veterans suffer from, even ones that wind up killing them for lack of care in the VA system, are things that they can deal with very effectively themselves. And so it's time to stand up and let's get busy and save our veterans ourselves. So the medical system, again, whether it's out there in the street, it's the clinics, it's the hospitals, or if it's in the government is the worst, right? Because people who have bureaucratic jobs, even medical doctors, they only work a couple hours a day. They don't do a good job because they have this thing in their head they can't get fired. There's no consequences to slacking off. There's no consequences to killing somebody. Is that crazy? Is that crazy? And so I urge everybody to encourage veterans to join Youngevity. And, of course, one of our areas that we do to support the community is we donate a lot of money to the Wounded Warrior programs. And so we do that, but that's not enough. We need to help people learn how to take care of themselves so they don't feel in their heart that they need to go to a doctor, especially a VA doctor. So what I want you to do is make sure that every veteran knows about my offer, that I will pay their $10 so they can become a Youngevity associate. They'll make some money helping other people, including other veterans, and they'll learn how to take care of themselves health-wise. Some of these guys apparently had died for lack of colonoscopic exams. Well, I'm not big on colonoscopic exams, but of course the cause of death was things that they had in their colons, which wound up killing them, and they went 245 days without the examination that they should have had 245 days earlier. Maybe it could have saved them. So you can go to a pharmacy without a prescription and get a occult blood test, which is a substitute for a colonoscopic exam. It'll cost you less than $5. The newest one, the high-techy one, is called a FIT test, F-I-T. It's an acronym for fecal immunochemical test. And these are things you can do in your own home. So I urge everybody to do these things themselves. And if you find something positive in there, then you go to a radiology lab just out in the general public and say, look, I need to have a high-resolution ultrasound, no radiation, no CAT scans, no MRIs, and you'll be able to get a lot of information. You'll be able to say, okay, I do need to go to a gastroenterologist to deal with this. Or you can say, no, everything's fine. The book, Let's Play Doctor, part of that trilogy, Let's Play Doctor, Let's Play Herbal Doctor, and Passport Aromatherapy, has a whole chapter on home laboratory, things you can do yourself at home. You can do a complete physical exam. What I recommend is, that's what I do, is when people come to my house for holidays, whether it's 4th of July, Christmas, New Year's, Thanksgiving, anytime people come to your house, I don't care if it's 2 or 22 or 222, you give everybody a physical. You go to the pharmacy before they arrive. You know, how many ever people are saying they're coming over. You get test strips, a multi-stick to test their urine. You can get test strips to test and see if you have diabetes or other blood sugar problems. They want to see hemoglobin and so forth. And then, of course, you want to have a blood pressure cuff, take your blood pressure, take your pulse, and so on. And these are things, take hair once a year to do a hair analysis and find out their mineral levels, what's going on there. They give you some sense of absorption capacity. It's amazing what you can do yourself. And so I urge you to get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and Passport Aromatherapy, and it'll teach you and them, the veterans, how to deal with over 900 different diseases using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, and aromatherapy oils. Teach you how to do your own parasite test. So many people come and say, well, I think I have parasites. In fact, there was a lady the other day who said she had parasites, and I was very skeptical when people get creepy, crawly feelings, and they'd say, I got parasites. So I said, if you don't want to do it yourself, and you can get the method, how to do the stool test yourself to look at eggs and wormy things, and one-cell parasites in a microscope. You go to a school, in your district, you're paying property tax to run that school. You have a right to go use one of those microscopes for 15 minutes. And the book, Let's Play Doctor, in that chapter, Home Laboratories, teach you how to do your own fecal exam for parasites. And if you don't want to do it, you take your own bowel movement to a veterinarian for $10. Say, hey, this is my dog's fecal deposit here, and I want you to check it for parasites. Well, this woman did that. And she found out she had roundworms, had the eggs, and even brought in some of the worms. So we know exactly what to do. You can look that up in the book. Let's Play Herbal Doctor tells you what to do for wormy-type parasites. It's an amazing thing. Okay, and she was just dumbfounded that she could do that herself. Didn't have to go to a tropical disease laboratory. Okay? And so I want you to get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to deal with over 900 different diseases using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, and aromatherapy oils. Now, the advantage of doing the Youngevity business as a business, as an associate for our veterans, you get tax deductions. You can be a great employee and not get tax deductions. You pay wholesale for everything. You get free shipping and auto ship. And let's see, car bonuses, stock options, all for one-time fee of $10. How good is that? Well, stick with us. We'll be back with Dead Doctors Don't Lie for these messages. Okay, Doug, what pearls of wisdom do you have for us today?
I thought we'd talk a bit about antibiotics, as I've got a CNN story here headlined, When You Need Antibiotics and When You Don't. Say you're sick, feeling achy, stuffed up in the head, painful cough won't go away, so you go to your doctor and demand drugs. Say recent research suggests that your physician will likely prescribe you an antibiotic, even if he or she knows it won't make you get any better any faster. According to Amanda Hellberg, she's a physician assistant at Scott and White Lago Vista Clinic in Texas, says research has shown that common infections do not require antibiotics, yet we continue to unnecessarily take them. In a letter that was published in the Journal of the American Medical Association, shows that doctors prescribe antibiotics for acute bronchitis approximately 70% of the time, despite decades of evidence demonstrating that these drugs don't work against respiratory illness. They go on to say, despite clear evidence, guidelines, quality measures, and more than 15 years of educational efforts stating that antibiotic prescribing rate should be zero, physicians continue to prescribe expensive broad-spectrum antibiotics, according to Dr. Michael Barnett and Dr. Jeffrey Linder of the Brigham and Women's Hospital in Boston. And they go on to list several common afflictions and whether or not antibiotics would be necessary. Say cold and flu, upper respiratory infections, common cold and influenza are caused by viruses. Antibiotics only kill bacteria. According to the CDC, best way to prevent the flu is to get a vaccination every year. If you've already got it, maybe take an antiviral drug to speed your recovery. Say the cold only lasts 7 to 10 days and will go away on its own. Bronchitis, they say acute bronchitis does not need antibiotics. Ear infections could be caused by a virus or bacteria. They say the only definitive method for determining what type of infection you might have would be to puncture the eardrum and cultivate the liquid. Say most U.S. physicians treat with antibiotics instead of obtaining the culture. And pneumonia, say it can be caused by a variety of things, bacteria, viruses, fungi. According to the Mayo Clinic, they say bacteria causing your infection, antiviral medications could be used if you have viral pneumonia, and of course an antifungal if you had a fungal type of infection. It's a sinus infection. Could be viral, bacterial, and once again, they recommend you go to your doctor on that one. And strep throat, they say, is a bacterial infection. Antibiotics are required to fight it. And they say the bottom line is consult your physician or a physician assistant when you feel ill. I think I'd rather call you, Doc.
Well, thank you for the high compliment. Appreciate that. You hit the nail on the head again, Doug. Absolutely, 99.9% of the time when people have, quote, a viral infection, there's no real reason for antibiotics. And certainly what it does is it gives the antibiotic a chance to figure out how to become a drug-resistant bug. The more you use it, the more it knows what to do to avoid being killed by the pharmaceutical. So basically, people have to, again, take care of themselves. They have to really reach down, get their big boy and girl pants on and say, I really have relegated my responsibilities for my health to the doctor, whatever he said I do, and I just don't pay attention otherwise. We have to be obsessive about being healthy. And what I do, of course, is I use the Pure Works. I like the spray. I like the foam. I like the lotion and the soap, the liquid soap, and the sanitizing materials in the PureWorks work for 3 to 5 hours after it dries. Alcohol and Purell and other alcohol-based skin sanitizers only work while they're wet. Take care of yourself if you're interested in bugs. Use her works instead of antibiotics. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Alabama. And Anthony, you're on with Dr. Wallach.
Oh, Anthony, you're on the air.
Hey, Doc. God bless you. How you doing today?
God bless you, Church. How can I help you?
Got a 14-year-old young lady, 140 to 145 pounds, 5'5", 5'6". Her mom says she's been having stomach pain since April, and her doctors don't know why she keeps having these pains in her stomach. And I did ask her about the dry skin, breathing issues, and digestive, but I believe she said her daughter had some breathing issues and possibly digestive issues as well.
Okay, so so she's 14 years old, weighs 140 pounds. She has some breathing issues, and she has stomach pains, or at least abdominal pains, discomfort. And I'm assuming 14 years old, she's either going through or has gone through puberty. And it's not unusual for these gals to have pelvic pain. They've got the whole development of the uterus and fallopian tubes and the ovaries. They are having ovulation going on and cysts and all that kind of stuff that goes along with it. It could be called dysmenorrhea. That's a possibility. She could have gluten intolerance. And so I want to put this one over to Shar. She's a lady, and she would know what to do here for a 14-year-old girl, a lot of stomach pains, digestive stuff, and some breathing problems. Shar, how would you handle this?
First, she needs to get on a gluten-free diet immediately, and then she needs the healthy start pack. But she needs a lot of EFAs and stuff for the breathing. That'll help that, and she could take the Women's FX for all the female problems. That would definitely help that. I know my sister, when she was going through menopause, I didn't realize she's the opposite, but it helps all kinds of female problems. Women's FX, it's a liquid. That'll do it.
Yeah, exactly right, Shar. Of course, we'd want to know whether these stomach problems or belly pain or pelvic pain occurs a week before her period, a week after her period, during her period. And so, again, Char's exactly right. Woman's FX, if the child prefers liquids, it'd be 1 ounce twice a day per 100 pounds of body weight, as long as she's having those problems. If she prefers a capsule, it'd be 3 twice a day per 100 pounds of body weight. It's 2 bottles a month of the Balance FX. And she's going to be a new woman. Even at 14, she'll be a new woman. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Hawaii. And Peter, you're on with Dr. Wallach.
Oh, Peter, you're on the air.
Thank you, Dr. Wallach.
Yes, sir.
I'm a Vietnam vet, and I was born in 1945. So some of our questions is Agent Orange, but mine now is Morgellons disease. What is that?
Okay, I'm sorry, I didn't get what the disease is.
Morgellons.
Oh, Morgellons.
M-O.
Mm-hmm. No, I've heard of that. Okay, Morgellons disease, and I've never seen it myself, but I've had people tell me that they had Morgellons disease, where little hair-like things come out of the skin. Is that what you're talking about?
Yes.
Yeah. Okay. And I'm not sure that I've ever seen it myself. And so here's, I view it as a form of fibromyalgia or lupus, or we have a connective tissue disease. And so what I would do, is this yourself, sir?
Yes.
Okay. How much do you weigh?
Right now I'm taking the 3 Healthy Start Pack.
Okay. How much do you weigh?
340.
Okay, so you're a big fella. How tall are you?
5'11".
Okay. Yeah, and so we need to lose, maybe, at least 100 pounds or so, maybe 120 pounds. We need to lose that. And I would take the Healthy Bone and Joint Pack, okay, is where I would start, and you need 3 of them. At 340, I would take 3 of the Healthy Bone and Joint Packs. That's going to deal with any connective tissue diseases. lupus, fibromyalgia, things of that nature, sarcoidosis. I get the sense that that's kind of the group that it's in. And certainly there's enough CM cream between those 3 healthy bone and joint packs to deal with any discomfort. Do you have discomfort in joints or muscle groups or your back or anything with this?
Back.
Okay.
Hands.
Okay, back and your hands?
Yes.
Okay. Yeah, so I would use the CM cream on your hands. I'd have somebody apply the CM cream to your back right down the middle and a couple inches on each side. I would also take the CM Plus capsules, the soft gel capsules. I would take 12 of those a day. I'd take 4 at breakfast, 4 at lunch, 4 at dinner. That's going to require 3 bottles a month of the soft gel CM Plus capsules because they're definitely anti-inflammatory and they have a analgesic property which relieves pain from the inside. Use the CM cream on the outside because you wind up with 3 wide-mouth jars of the stuff to apply topically for discomfort. In addition to those 3 healthy bone and joint packs, I would also throw in what we call Immortalium. That's one of our newer products that deals with encouraging the body to make stem cells and make your healthy cells survive longer. And to help you lose that 120 pounds you need to lose that heavy, take 2 bottles a month of the ASAP. Take a full dropper full 30 minutes before each meal under your tongue. Leave it absorb through your tissues of your mouth. Take another dropper full 15 minutes before your meal. Let it absorb through the tissue of your mouth. And you'll begin to lose a half pound to 2 pounds a day. And call me every 2 weeks if you would, please, Peter. I'd really like to track this one because I think together we can save a lot of vets. We'll be back after these messages.
Let's head to Virginia. And Shirlette, you're on with Dr. Wallach.
Hey,
Hi,
Shirlette,
Dr.
you're on the air. Hi.
How are you?
Okay, thank you. How can I help you?
Well, I was calling Monday. I had a surgery to remove remove a cyst off my ovary.
Okay,
and while I was
last
in
Monday,
surgery,
wait a minute, this was this last Monday, or you're having it scheduled?
no, this past the 12th. The 12th.
Okay, so you had it done the 12th, okay?
Yeah, they removed the cyst and they removed the ovary as well as the tube. And while I was in surgery, my blood level, my blood pressure went up high, and my heart rate dropped low. So they kept me in the hospital 3 days. But while I was there, they also started talking about I had thyroid, hyperactive thyroid, and they had set up an appointment for me on Wednesday to come in to take 2 pills, some kind of radioactive pills, because they want to make the hyperactive thyroid inactive, and then said that I was going to have to be on a prescription drug for the rest of my life. Well,
they don't want to make it, listen, they don't want to make it inactive. When they give you the radioactive iodine, they're going to kill your thyroid. They're going to kill it. You're going to be locked into taking either Synthroid or one of the other synthetic thyroid hormones forever. I mean, you can't go back to that. And so, first of all, how tall are you?
About 5'4".
And how much do you weigh, Charlotte?
About 140.
Okay. Now, do you have any other issues, any skin problems, any eczema, dermatitis, or psoriasis, or chronic respiratory stuff, bronchitis, asthma?
No, I have a little adult acne.
Okay. Is that on your face?
Yeah.
Okay.
And on my back and on my back.
A little bit on your back. Okay. Do you have any children?
Yes, I do. Two sons.
Okay. Now, do they have any history of asthma or skin problems or belly problems, any diarrhea, constipation, anything like that?
Well, yes. My oldest son, he has the acne, and my younger son, he had bowel problems.
I'm sorry, he had what kind of problems?
Bowel, like it's going to the restroom.
Okay, had bowel problems.
Yes, yes.
Is he constipated?
Yeah.
Okay, so he's constipated, couldn't go. Yeah, you have gluten intolerance is your problem, and your sons have gluten intolerance. That's why you got acne. That's why you have skin problems. That's why he's got bowel problems. And I certainly would not let him kill your thyroid at 140 pounds at 5'4". You might be, at the most, you might be 10 pounds overweight or something like that. It's not that big a deal. Usually when you're hyperthyroid, you'd be 5'4" and weigh 100 pounds because your thyroid's racing away and you're going to be very skinny and so forth. Your eyes bulge out? Do you have bug eyes?
No.
Yeah, that's called exophthalmos. That usually goes along with hyperthyroid. So, two of the things is classically with hyperthyroid, you don't have them. And so, let's see here. I don't know what the thyroid's connection is with a ovary that's cystic. So what I would do is have you take the 9 essential nutrients. I would have you take the. Are you already taking our program of any kind?
I was, and I had stopped, but I'm. That's why I'm calling, because I want to get back on my product.
Okay, what I do is get on the basic Healthy Start Pack, right? That'll allow you to have. I go ahead and take 2, per month, and that will allow you to have 1 ounce of the OsteoFX Plus at breakfast and dinner. Allow you to take 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner. 3 of the EFA Pluses at breakfast and dinner. All that will be accomplished by the 2 Healthy Start Packs per month. And because you have a thyroid issue, and I don't think you have an overactive thyroid, I think that's all a bunch of nonsense, I would go ahead and have you take 3 of the Ocean's Gold tablets, or little green tablets, twice a day, 3 at breakfast, 3 at dinner. There'll be 2 bottles a month of the Ocean Gold. And I would start there. There's no big rush to judgment here. It sounds to me like the doctor needs a Mercedes payment or something. You know, he's trying to get you married to him by killing your thyroid. So you have to go visit him 4 times a year minimum, and keep getting monitored and take this drug. And now we got this new experimental drug, and now we got this. And I would just not do that. If you're not convinced to listen to me, then I can understand. But what you want to do is, at the very least, get another opinion from a doctor in one of the medical schools there in Virginia. That way, he has no axe to grind to make money, because he's going to get paid the same no matter how many patients he gets. So I'd go to one of the university doctors and say, okay, give me what you think, and before you decide to do anything, call me back with any new data. Okay? Okay, Doug, let's go to callers.
Let's head to Los Angeles, California, and Robert, you're on with Dr. Wallach.
Oh, Robert, you're on the air.
Hi, Dr. Wallach. I'm calling because my dad has like a host of different diseases going on. He has kidney failure, 5%. Is on peritoneal dialysis. Also has diabetes, high blood pressure, sleep apnea, hidradenitis suppurativa, cataract.
Okay, wait a minute. I missed after the high blood pressure. What else?
Sleep apnea.
Okay, sleep apnea. Mm-hmm.
Hidradenitis suppurativa.
Okay, now tell me what that is.
That's like a skin condition where it fills with like pus or stuff, and blood and all that.
Okay, so he has pus and blood in his skin?
Yes.
Okay.
Like it kind of seems like a pimple. Like it just.
Okay, now we used to call that impetigo when I was a kid.
Impetigo.
Yeah, we have little boils in the skin, and they bleed and drip pus and stuff like that. Yeah, usually under the arms, kind of places.
Yes.
Yeah, okay. Yeah, we used to call it impetigo. So kidney failure, diabetes, I'm assuming type 2?
Yeah, but doctor, it's like 17 different things I have on the list.
I understand. So let's say he's got 5 more diseases. What else has he got? How much does he weigh?
He weighs 200 pounds.
And how tall is he?
Like around 5'4" or so.
Okay. Yeah, so he's 60 pounds overweight. And let's see here. Yeah, I mean, he may have dental problems and ringing in his ears and all that kind of stuff. But when you have this many problems, he has a basic underlying problem. So I want to give this one over to Shar. I know she'll be able to tell you. And I'm just going to repeat these for her. He's got type 2 diabetes. This is his father. He's got type 2 diabetes, high blood pressure.
Okay, he needs
kidney failure.
Oh dear, he needs the healthy blood sugar pack, and is he over 200 pounds? Okay, so he needs 2 healthy blood sugar packs, and for the other issues, he needs high blood pressure. He needs the Ultimate Daily to open up any plugged up afferent arteries, and that'll take care of his high blood pressure. And
okay, what about sleep apnea?
Sleep apnea. There's no such thing as sleep apnea. That's just all pretend. It's not a disease. My husband told me that I quit breathing when I sleep too. So do my dogs. It's natural breathing pattern. So yeah, it's nothing to get excited about. Everybody does it. Everybody has it. Not a disease. Not to worry about it. But just take 2 healthy blood sugar packs and Ultimate Daily.
And have him test his blood sugar
And test your blood sugar in the morning before you do any kind of medication or anything.
Okay. Well, that's good advice for your dad, Robert. And give us a call every couple of weeks. I want to know your dad's blood sugar levels, his blood pressure levels, his weight, and sleep apnea. If it's bothering his sleep partner, he can sleep in separate bedrooms. Guess what? Nobody dies from sleep apnea or snoring unless your sleep partner shoots you. We'll be back after these messages. We're back with Dead Doctors Online, the ZBS Radio Network. Dr. Joel Wallach here for Youngevity and 95 Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. Okay, Doug, let's go to callers.
Let's head to Houston, Texas. And Jennifer, you're on with Dr. Wallach.
Hello, Jennifer, you're on the air.
Hi, Dr. Wallach.
Hi.
Hi. My father-in-law has chronic inflammatory demyelinating polyneuropathy, and I was wondering if there was anything we could do for him.
Okay. Now, is this in the brain, the spinal cord, or is it in the peripheral nerves?
Okay, how would I know? It's affecting the strength in his arms and legs. He can hardly walk anymore.
Okay. How old's your dad?
It's my father-in-law. He's like 76.
Okay. And then, how much does he weigh?
Like 185.
All right. Any other issues? Any dry skin, eczema, dermatitis, psoriasis, any asthma, bronchitis, any constipation, diarrhea, anything?
No, he was diagnosed with sleep apnea, which I just heard isn't really a condition from listening.
Right, it's a normal behavior.
Yes,
100% of the people who are sent to a sleep lab for a diagnosis get diagnosed with sleep apnea because it's a normal behavior.
Okay.
And all doctors who diagnose it should be put in jail for fraud.
I agree.
And if you ask my opinion, I'll tell you. Okay, so what do we do for your dad?
Yeah.
These sorts of things can be related to everything from Lou Gehrig's disease, Parkinson's disease, MS, and so that's kind of the area that when you talk about demyelinating diseases, does he have any memory problems or memory loss?
No, not really. I mean, just kind of normal, what you would expect for someone his age.
Well, I'm 75.
I know, but you take all these great things for he doesn't take all that. He doesn't take all that. So a normal American, you're not normal because you
Oh, my God, I'm abnormal. Oh, my.
Yes, you're smarter than the normal American.
Oh, well, you're too kind. Okay, well, here we go. What I want him to do is have 10 to 12 eggs a day. Okay, we got to rebuild the myelin. The myelin makes up 75% of your brain weight. It's the insulation material of the brain, and it's 100% cholesterol. So he needs 10 to 12 eggs a day. If he weighs 250, I want him to have 16 to 20 eggs a day. Okay, I get people taking 25 eggs a day. They deplete the local chicken population, but that's okay. And we can actually help them support and promote maintenance repair of the myelin. And so 10, 12 eggs a day. You then get rid of all the bad stuff that's going to damage the myelin. No fried foods, no processed meats. That means no deli slices, sandwich meats, no sausage, ham, bacon, bologna, salami, pastrami, pepperoni, and jerky. Absolutely. No oils. It means no olive oil, no coconut oil, no margarine, mayonnaise, salad dressing, cooking oils, and no gluten, no wheat, barley, rye, and oats. Now, I would also have him take the glucogel. I'd give him 2 bottles of glucogel. Or he could take 15 a day, 5 at breakfast, 5 at lunch, 5 at dinner. I'd also have him take the de-stress capsules, 3 of those 3 times a day. There's 3 at breakfast, 3 at lunch, 3 at dinner. That would be the de-stress capsules, capital D-stress. And this is going to give him all the raw materials to support and promote maintenance and repair of all connective tissue, which would include cartilage, ligaments, tendons, connective tissue, and also the myelin is a kind of a form of a fatty connective tissue. But that's the area I would go. And then I want you to call me every 2 weeks, because even people have seizures. They tend to turn around very quickly with this program, because when you give even the brain the raw materials, medical doctors are still locked into that theory that the brain only requires sugar. That's all but just a bunch of nonsense. The brain requires 90 essential nutrients, and I'd go ahead with the 2 healthy brain and heart packs, 2 healthy heart and brain. Let's turn around the 2 healthy brain and heart packs a month. That will allow them to have 3 selenium twice a day. the OsteoFX Plus, an ounce twice a day, 2 scoops of the Anti-Tangerine 2.0 twice a day, 3 of the EFA Pluses twice a day, and 3 of the EFAs twice a day. And the de-stress capsules and the Ultimate Dailies. Okay? Give us a call every couple of weeks. Bring us up to date on your dad. The sleep apnea, don't worry about it. Teach him how to sleep on his side. Nobody ever dies from snoring and sleep apnea. These are normal procedures. If it bothers a sleep partner, have them sleep in separate bedrooms. Okay, well, thank you, everybody. Thank you so much, Shar. Thank you, Doug and Susan. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.